There has been research in somatic factors, or also they looked at if it's the treatment that caused the fatigue or type of cancer. And actually what we can say, it's not related to specific treatment, it's not related to a kind of treatment, although stem cell transplantations, after that people have higher risk of becoming severe fatigue than when they only have, for example, an operation. But there's no one-on-one relationship because it's multifactorial. So there are many factors that make the fatigue and probably also the cancer itself. And then what's helpful is to see you have some cause of the fatigue, but then after treatment you would expect that it will go down and people get less fatigued. And then, but there are factors that are perpetuating the fatigue, and these are mainly, I think, behavioral factors. So that's also what a therapy is about. If people have lymphoma, it affects their immune system, and stress is also affecting the immune system. So there are some professor in the Netherlands, and he said people can get more sensitized to stress after infection or lymphoma, or also after severe stressful life events early in life. People get more sensitized to stress. And then when you have stress and your immune system is activated, you get sickness behavior. So you feel like you have to need rest. But then if you want to cope well, you don't rest all the time, because then you become more fatigued. And so people get more sensitized to stress. That's I think the best I can explain. One also very common problem after cancer is that people have fear of cancer recurrence. And this is also can be one of the perpetuating factors. If people have a lot of fear, it also can make them tired. So I think for doctors it's good to be aware of this problem of fatigue and what it means to people, and that they can learn, and also to become aware how much burdened they are by the fear of recurrence. And if doctors can give good information, it may help people to become less fearful for recurrence. And still, you know, some fear of recurrence is normal, but sometimes it's too high, and also people become distressed and they get functional limitations because they are ruminating all the time about fear of recurrence, and then it's not helpful anymore. So that's another major theme that's good for physicians to be aware of.